8 ways to naturally and safely lower blood pressure without medication in 7 days for people with high blood pressure. High blood pressure is often referred to as the silent killer because it usually has no symptoms, yet it is a major risk factor for heart disease and stroke, one of the leading causes of death. Fortunately, by adhering to a healthy lifestyle, you can naturally maintain stable blood pressure, prevent complications from high blood pressure, and reduce the risk of cardiovascular diseases. Although high blood pressure is a well-known medical condition, its treatment is never easy, even in advanced countries, where the rate of patients achieving targeted blood pressure levels is still lower than expected. High blood pressure is a common condition that affects the body's arteries. When blood pressure is high, the force of blood against the artery walls is consistently too high, causing the heart to work harder to pump blood. Untreated high blood pressure increases the risk of heart attack, stroke, and other serious health problems. Most cases of high blood pressure have unclear causes. Alongside uncontrollable risk factors such as age and family history, nutritional and lifestyle factors are controllable risks. Controllable factors for preventing high blood pressure. Diet. A habit of eating salty, high-sodium foods increases the risk of high blood pressure. Therefore, you need to reduce salt in your diet. Instead, enhance your diet with more vegetables and fruits, whole grains, etc., to lower the risk of high blood pressure. Physical inactivity. Less physical activity increases the risk of high blood pressure. People who are inactive have higher heart rates, which makes your heart work harder and can potentially increase blood pressure. Therefore, you need to engage in more and more regular physical activities to reduce the risk of illness. Overweight or obesity. The heavier the body weight, the more blood your body needs to pump. This puts more stress on the blood vessels, increasing the risk of high blood pressure. Therefore, maintaining a reasonable weight and losing weight if overweight or obese will help control blood pressure. Smoking. Nicotine in tobacco products stimulates the sympathetic nervous system, causing blood vessels to constrict and raise blood pressure. Quitting smoking is one of the best things you can do to reduce the risk of high blood pressure and heart disease. Alcohol consumption. Drinking alcohol is a leading risk factor in the onset of high blood pressure as well as complications from high blood pressure such as stroke, heart attack, arrhythmia, gout, and increased blood triglycerides. You should apply the following methods to gently treat your high blood pressure after 2 weeks. 1. Limit salt intake. In the TONE, trial of non-pharmacologic interventions in the elderly, trial, patients were randomly divided into 2 groups, one with a reduced salt diet with a sodium intake of only 1.9 grams per liter per day, and another group without any dietary changes. It was observed that the group with the dietary intervention had an average decrease in systolic blood pressure of 2.8 mm of mercury. Subsequent studies investigating changes in blood pressure with different amounts of salt intake found that blood pressure varied in step with the changes in salt intake, and naturally, blood pressure would decrease more with a greater reduction in salt. As a result, a recommendation was made for patients with hypertension or prehypertension to limit daily sodium intake to under 100 MEq, or 2.4 grams. 2. Regular exercise. If you do not have high blood pressure, regular exercise can help you avoid this condition. If you already have high blood pressure, regular physical activity will help reduce your diastolic blood pressure to a safer level. Numerous studies have shown that exercising for at least 150 minutes per week can reduce blood pressure by 5 to 8 mm of mercury in people with high blood pressure. It's important to maintain a consistent exercise routine because if you stop exercising, your blood pressure can easily rise again. Some exercises suitable for people with high blood pressure include walking, jogging, cycling, swimming, dancing. You can also practice high-intensity interval training, which means exercising at high intensity for 10 minutes, then switching to gentle exercise, and repeating the cycle every 30 minutes. 3. Maintain a healthy diet. According to the dietary approaches to stop hypertension, diet, adhering to a menu that includes plenty of whole grains, high-quality proteins, calcium-rich foods, potassium, magnesium, fruits, and vegetables, while eliminating saturated fats and cholesterol, can reduce blood pressure by up to 11 mm of mercury. Additionally, it's necessary to cut down on refined sugars and refined carbs in your diet. Studies indicate that a diet low in refined carbs and sugars effectively stabilizes blood pressure. Specifically, people who followed a diet low in carbs and sugar for 6 weeks improved their blood pressure and other cardiovascular health indicators compared to those who did not follow this diet. Salt is also considered the nemesis of patients with high blood pressure. Just reducing a small amount of sodium in the diet can improve cardiovascular health and reduce blood pressure by about 5 to 6 mm of mercury in people with high blood pressure. 4. Avoid alcohol. Drinking excessive alcohol can increase blood pressure and lead to many dangerous complications in patients with high blood pressure, especially heart attacks and strokes. Alcohol abuse is extremely harmful to health. There is a particular risk of rupturing blood vessels in people with high blood pressure, a condition that cannot be controlled even with medication. Alcohol causes the heart to beat faster and blood vessels to constrict, leading to increased blood pressure. When blood pressure spikes, it can lead to other dangerous cardiovascular complications such as stroke, including cerebral hemorrhage and heart attack. Studies have shown that people who consume too much alcohol have higher blood pressure levels than others, ranging from 5 to 10 mm of mercury higher. Additionally, it causes severe damage to other organs, most commonly the liver and kidneys. In some cases, toxins from alcohol can accumulate and cause stomach ulcers, liver cirrhosis, and cancer. Drinking a lot of alcohol is also a risk factor for metabolic disorders, including fat, sugar, uric acid imbalances, abdominal obesity, and difficult-to-control weight gain. These are also factors that can increase blood pressure. 5. Reduce caffeine intake. Caffeine can increase blood pressure by up to 10 mm of mercury in people who do not regularly consume caffeine. However, regular coffee drinkers believe that caffeine has little or no effect on their blood pressure. To determine whether caffeine increases your blood pressure, measure your blood pressure within 30 minutes of consuming a caffeinated drink. If it increases by 5 to 10 mm of mercury, it indicates that your body is sensitive to caffeine. In that case, you should reduce your daily caffeine intake. 6. Reduce stress. Chronic stress can contribute to an increase in blood pressure. Take some time to think about the causes of your stress, such as work, family, finances, or illness. Once you've identified what causes stress for you, you need to find ways to resolve it and eliminate stress from your life. If you are having problems at work, talk to your superiors, reduce your workload, and take more time to rest. If you are experiencing conflicts with your children or spouse, have a direct conversation with them to gradually resolve the issues. Try to avoid stress triggers. For example, if you often feel stressed due to traffic jams when commuting to work, consider waking up earlier, avoiding peak traffic hours, or using public transportation. Or, if there's a colleague in the company who always makes you uncomfortable and stressed during conversations, try to avoid interacting with that person. Spend time relaxing and engaging in activities you enjoy, such as walking, cooking, or volunteering. Traveling is also an effective way to relieve stress if you have the time. Meditation or deep breathing. Both meditation and deep breathing activate the parasympathetic nervous system. This system operates when the body is relaxed, slowing down the heart rate and reducing blood pressure. 7. Eat garlic or take garlic extract. Fresh garlic or garlic extract is widely used to reduce blood pressure. A study has shown that for people with high blood pressure, daily garlic supplementation can help reduce systolic blood pressure by up to 5 mm of mercury and decrease diastolic blood pressure by a maximum of 2.5 mm of mercury. You can consume raw garlic or use it as a spice in cooking. It is important to note that you should only eat 2 to 4 cloves of garlic per day, as consuming more can have the opposite effect and cause a drop in blood pressure. 8. Ensure long and quality sleep. Blood pressure usually decreases when we sleep. Insufficient or poor quality sleep can significantly affect blood pressure. This is why people who regularly experience insomnia or lack of sleep, especially older adults, are at risk of developing high blood pressure. To improve the quality of your sleep, try the following methods. Establish a habit of going to sleep at the same time every night, ideally before 11 p.m. Spend time relaxing before going to bed. Listen to music, read a book, play with your children, or watch a light-hearted romantic movie instead of working on your laptop or using electronic devices like phones and tablets. Exercise regularly. Avoid napping for more than 30 minutes. Design a comfortable and soothing bedroom environment. Pay attention to the temperature and lighting, and consider using herbal essential oils for relaxation, which can help you fall asleep more easily and enjoy better sleep. In summary, we can naturally control high blood pressure in 7 days without medication using these methods. They are easy to implement, and you can note them down and remind yourself to practice them daily. After 7 days, your blood pressure condition will significantly improve. You can continue watching videos to improve your blood pressure condition on the right, or follow the channel to learn the most effective methods that we have compiled on this channel. Thank you for your support of the community.